In this video, we will discuss about Trichomonas gallinae. The disease caused by the Trichomonas gallinae is called as Avian trichomoniasis or upper digestive tract trichomoniasis. Lesions such as cankers or yellow buttons observed in the pigeons. And the host are primarily pigeons. Chicken, turkey may they may also act as the host. And the parasite is located in the upper cavity or anterior end of the digestive and respiratory tract. Organism is feriform in shape. There are four anterior flagella arise from the blebroplast, but the posterior periflagellum is absent. This is unlike in case of Trichomonas fetus. When it comes to the life cycle, this is divided by the simple division, that is binary fission, and they do not form cyst. It is transmitted from one bird to another via infected pigeon feeding on the young squabs and the contaminated drinking water. When it comes to the pathogenesis, it is the disease of young birds. Young ones of the pigeons are called as squabs, and 80 to 90% of the adult pigeons are infected but show no signs of the disease. The earliest lesions appears as small yellowish circumscribed areas in mouth cavity, especially the soft palate, and these lesions increase in size and number and extend to the esophagus, crop, and proventriculus, and they look yellowish caseous nodules. The disc-like circumscribed thick caseous necrotic masses may occlude the lumen of the esophagus, and often they called as yellow buttons. The lesions of the digestive tract do not extend beyond the proventriculus. These are restricted to the up to the proventriculus, and they do not extend beyond the proventriculus. The organism invade the pharyngeal gland and penetrate the underlying tissue and reach the liver, where they cause abscess in the liver, may lead to the death. The lesions produced by the Trichomonas gallinae is otherwise called as the cankers. When it comes to the clinical sign, the infected pigeon squabs show initial depression with ruffled feathers, and later they become weak, emaciated, and be unable to stand or maintain their balance. And there is an accumulation of a greenish fluid or cheesy material in the mouth and the crop. This may exude from the beak. Then erosion of the papillae on the palatal flaps is a good sign of the infection. The birds may have difficulty in swallowing and breathing due to cheesy-like deposits in the mouth lining. And in turkey, fowls, and chickens, there is drowsiness and pendulous crop are usually observed, and there is a foul odor from the mouth. In postmortem lesions, there is yellowish to grayish necrotic lesions are evident in mouth, crop, and esophagus, and also in liver. Organisms are usually very numerous in the mouth and crop content. When it comes to the immunity to the Trichomonas gallinae, recovered birds are immune to reinfection, but they survive as a carrier. It can be diagnosed by the clinical lesions like characteristic lesions in oral cavity, esophagus, and the crop, and usually the organism is readily demonstrated in the greenish fluid material or in the lesions. It can be treated by using metronidazole, and to control the disease, elimination of infection from the adult by the drug treatment, because the adults are act as the carrier to the young ones, and introduction of the infection from the wild pigeons and other birds may be prevented by shielding the drinking places. This is about the control aspect of the Trichomonas gallinae. Now we completed the genus Trypanosoma, genus Leishmania, and also genus Trichomonas. Now in next video we will discuss the another genus, that is Histomonas.